Good afternoon, everyone. So, now uh, under the subject of oncology, we will be talking about nursing care of cancer patients. We discuss about the symptoms management. Now we will be talking about nursing care of cancer patients, and at the same time, we will discuss on pain, especially. Right. So, let's move on. Right, the nursing management of patients treated with surgery. First of all, let's focus on cancer or onco patients who are like post-op onco surgery. The nurse's responsibility is to care for the patient in a different aspects. Here, the nurse responsibility is to care for the physical problems and provide psychological support. In a case of oncology or in a case of cancer, the psychological support is very much important. That you all know as nurses. The nursing diagnosis after the cancer surgery or nursing management after the cancer surgery must be pay attention to the first point, the body image disturbances related to loss of body parts. So that as nurses we should understand. The body image disturbance could be there which are related to the loss of body parts. Then at the same time risk of infections related to the surgical wound. Then sexual dysfunction. Then impaired skin integrity related to colostomy. Now for an example, most of the time in cases of colorectal cancers and all, the colostomy might be there, so we have to pay attention to that point, that there's a higher risk of getting infection and like post of infections and all. So we and that might be a um, that might adversely affect for their sexual life, and that might damage the personal body image like that. So as nurses we have to pay attention to that point very much, right? So next is the body image disturbance, which is very much important. So nursing management for a patient with breast cancer. Now for an example, here assess for grieving for the loss of breast and change of the body image. Of course, for a female, when she loses such a body part which is very much important for her body image, of course the grieving for the loss of that body part will be there. So here we got assess for grieving for the loss of body, loss of breast and changes of the body image. Then assess for possible loss of self esteem and sense of femininity. She might be losing the sense of femininity, being a female, that the self esteem of being a female may go away. But as nurses we should diagnose that point. So as an intervention, as nursing management technique, we can give emotional support for the patient. Yes, emotional support for the patient. At the same time allow patients to discuss feeling and concerns on body image. Now we can allow her to discuss her feelings, her own feelings and concerns on her body image. There are implants and also there are many options there could be. So then help patients to express her feelings about the loss of her body parts through surgery. What is this like, what are they focusing on? Basically focusing on, we should allow patient to talk, and as nurses we should listen to the patient. So that is very much important, to listen to the patient first of all. Okay, either to give emotional support or to get an idea about her loss of body part, let her grieve and just allow patient to discuss her feelings, her true feelings. So listening ability to listen, you got to be very patient in this case. Okay, patience should be there in you. So help her to get rid of that grief, right? Then counsel patient and their spouse. That is very much important. Sometimes in, especially in South Asian countries, the spouse might be sometimes way more upset than the patient. Yes, about her body image and all. So the counseling of this patient and the spouse is also very much important, and that has a equal importance. Then counsel husband to accept the body part loss and look at it positively. Of course a husband should support his wife and to look positively, that you all should counsel them as nurses, and nurses should be doing this. Then advise patient to talk with other women in similar situation and find out how they cope with the loss of her breast or body part. Now here, that is very much important, one of the very important points, sorry, where we meet same kind of people. Now for an example, if we fail in an exam, of course, now this is the human nature. I am not being selfish, or I am not being I am not discussing on that particular point, right? That's the human nature. Now if we are failing in an exam, what happens? We we grieve for our loss or the failure, but at the same time, if that's only us who has failed, then the grief is more, and that means we emotionally break down. But if there are like few other people, what happens? We feel like, oh, that's okay, I am not the only one, we all have a chance again, right? Like that. So we will be preparing, that will be a relief for us. So like that, now this patient, when she get to talk with other women who have undergone the same situation, or who have lost their body part or breasts, now if she the if this particular patient get to talk with those women, that will be a relief for her. So we must advise patient to talk with other women who are in similar situation, and that will be helpful for her as well to cope up with the problem. She might get good advices from those women, right, or those females, right? Advise patients on the physical aids available. Yes, there may be implants or any other physical aids, not to disturb the body image, right? Specially made bras are available for women who lost their breast. Yes, we can advise them on those things, right? Then also use of breast prosthesis. Yes, the prosthetic use, in cases of limbs and all. So for breasts also we have prosthetics. Then breast construction surgery that can be done at a minimal cost, that is also there. Then explain the procedure of breast construction surgery and its advantages, and also assist patient in making adaptations in daily activities, the marriage and the sexual relationships, right? So because the sexual relationship might get affected in such case, right? So risk of infection and injury related to surgical wound and improper lymph drainage. Now under this thing, first of all, the assess for signs and symptoms of infection in the wound. Assess for signs and symptoms of infection in the wound. In mastectomy, or in this mastectomy, removal of the breast, then assess for swelling of the affected arm, right? Then also observe for any delayed wound healing, like any delay in wound healing, we should observe for that, right? At the same time, nursing interventions for lymphedema. Educate patients on lymphedema and how to prevent it. Educate and instruct patients to do arm exercises constantly to get rid of lymphedema, and at the same time advise patients on positioning the arm and not to do any household chores and moving heavy objects until wound heal. Now this is very much important, but why? Most of the time women, they go home, and as soon as they go home they start to do household chore, but that's we have to advise them on positioning of the arm, and not to do any household this chore, and not to move or not to carry any heavy objects until wound is completely healed. Okay, right? Then monitor wound for inflammation, tenderness, swelling, or any purulent discharges or any pus. Then prevent infection through constant change of dressing using aseptic technique. Now what is this? We have to change the dressing to prevent infections, and we got to keep that area of wound in a clean and a dry state, right? Then about sexual dysfunction related to body function alteration and body changes. Now in this slide we are focusing on the sexual relationship or the sexual dysfunction. Assess patient's perception towards sex and factors that hinder patient's sexual behavior. Now after such kind of a surgery, patient might be not very much interested in a sexual relationship. Okay, now she knows that her body image has been disturbed, but what doesn't matter that just a surgery, that doesn't matter that they cannot have a good sexual relationship. So assess patient's perception towards sex and factors that hinder patient's sexual behavior. We got to assess them. Then assess the severity of the impact of body change on the sexual behavior. Now assess the severity of sexual dysfunction. Now sometimes the body image may be directly involved in sexual relationship, but sometimes that maybe that loss doesn't have any significant role in sexual relationship. So we have to assess the severity of the impact of that surgery, right? Then as a nursing intervention, what we got to do, educate patient on the importance of maintaining sexual relationship between wife and husband to continue normal sex life. Now here, whatever happens, the spouse or the wife and husband, they should continue their sexual relationship in a normal manner. To use different sexual positions, maybe now the patient is not interested because maybe not directly because of the surgery, maybe some other cause. So in such cases, what we got to do, we have to advise them on using different positions. Then importance of fitting the ostomy pouch correctly and empty it before getting closer to the spouse. Now here this happens in case of what especially in colorectal cancers and all, the ostomy pouch, or we call it the colostomy pouch, most of the time there's this stump, and when the colostomy has done, now it's very much important to take care of the pouch as well. Now that's important in sexual relationship as well. Now before going to the partner, the clean to take care of the pouch and to clean the pouch, and here the then closer to the spouse, then spraying deodorant prior to sex performance, then covering the mastectomy area or ostomy pouch with a nightgown, and sexual counseling. There are many things that these things are not the patient or a couple should not make these things a lame excuse for their normal day-to-day relationship. So in such cases, as nurses, that's our first duty to advise or to educate them on these matters, right? Then nursing patient treated with chemotherapy, how to nurse or how to nursing the patients who are getting treated with chemotherapy. Nursing management has two types: administration of chemotherapy and management of side effects of chemotherapy. Yes, nurses must strictly adhere to the guidelines of assessment and administration guidelines of chemotherapy drugs and handling of cytotoxic drugs. For guidance, you can refer to these pages 132 to 137. Here there are two types of nurses who are involved in chemotherapy. One type who administer the drugs, the other type who manage the side effects of the chemotherapy, right? One of the main side effects and very common and very famous, rather I would say the famous side effect is what? The alopecia, and we have constipation, we have a painful complaints of pain, and there are many side effects, right? Management of chemotherapy side effects, here nausea and vomiting, that is also a very much common side effect, and so we got to provide medication in case of nausea and vomiting as follows: ensure antiemetic agents given before chemotherapy to prevent vomiting, then ensure they are normally discharged with antiemetics, then severe antiemetic to control nausea and vomiting. Then we got to educate the patient that uncontrolled nausea and vomiting can lead to nutritional defects and electrolyte imbalance, of course, and to take food in small amounts, not in large bulks at once. Then to avoid eating fatty, spicy or fried foods, that is very important. And to replace supplements lost by taking isotonic drinks, and also to go for relaxation or recreational therapies, as we discussed in last lecture. Then about the control of the environment, provide calm and quiet environment and avoid bad odors, that we discussed in last lecture as well. Then we got mucositis. What is that? The severity, we got to assess the severity of mucositis, patient's coping mechanism, and assess if there's any pain. Then to educate the patient on oral hygiene and to prevent complication and on intake of food and drinks. If patient has pain, do pain management. We got to do the pain management. Then also another side effect is what? The taste alteration, the difference in sense of taste. Assess for taste alteration, the patient's coping mechanism, any obvious weight loss, loss of appetite, and patient's status of oral hygiene. Sometimes taste alteration may be due to poor oral hygiene. Okay, altered taste he or she may get, right. So in such cases, we got to encourage the patient to eat, reassure, and patient to eat, reassure the patient. Patient has to continue eating. Now, what is that? To encourage patients to and reassure the patient that patient has to eat, okay, continue eating, and advise patient to gargle mouth before and after eating. Now that's very much effective sometimes, to gargle mouth, before and after, so there will be a good taste alteration will be minimal, not a good taste alteration would be minimal in such case, right. Then another side effect is diarrhea. The management method, the nursing management, encourage patient to take low residual diet. Then educate the patient to monitor frequency of diarrhea and prolonged effects of diarrhea. Then monitor patient status for electrolyte imbalance. Yes, in diarrhea that is very important. Then administer antidiarrheal medication and do a stool culture. Right. Then in constipation, in last lecture also we discussed that we got to keep a record of this bowel habits and encourage more fluid or high fiber diet and stool softness, and encourage the patient to do gentle exercises of lot of walking to gain this peristalsis ability back to normal, bring back the motility, the gastric motility, to bring back the gastric motility into the normal level, right. Then we have pruritus or pruritus. What is that? Here, then management educate and advise the patient to avoid hot water and soap as it makes skin dry. Encourage patient to wear loose fitting clothes and to take well balanced diet and lot of water and take care of the skin, and at the same time consult the doctor if there's a sign of infection, right. Then the most famous, let me call it the most famous side effects, that is alopecia. Educate the patient on hair loss, that he might lose his hair. Then to use wigs, a scarf or cap if he feels shy, and not to cover his head with when he is at home. At the same time, if hair doesn't grow back, to consult the doctor. And we in last lecture also we mentioned that we must advise patient to use a baby shampoo or a very soft shampoo, and at the same time not to comb vigorously or not to do anything vigorously to the head, to use soft pillow covers, and at the same time to use a wig sometimes, or to use a soft comb and comb in a very gentle manner. Like that we have to take care of our head, right. Then the bone marrow suppression is another side effect. Assist the patient knowledge on bone marrow suppression, like we should ask patient and we should get an idea whether patient have an idea about bone marrow suppression or not. Then any signs of infection, advise patient to avoid crowded areas, contact with people having contagious diseases and animals, because when the bone marrow is suppressed, but yes, that directly affects to our immunity, right. Then encourage patient to maintain good personal hygiene, keep fingernails short and clean, uh, do mild exercise to keep fit, take lot of fluid and rest. Right. In any other case, they can consult a doctor. Right. Then the next side effect is impaired skin integrity. For an example, in uh, cases of colostomy, we said there's impaired skin integrity, but here we are focusing on the management of radiotherapy side effects mainly. Now, assess the skin daily for any skin reaction and educate patient to avoid using soap and to clean skin area with warm water. Advise patient on the following: on what not to apply any form of powder, cream, lotion or deodorant, then not to apply any traditional medication over radiated skin, then to protect the irradiated skin from any injury, heat and sun, then to avoid rubbing and scratching of the affected area. Then the next side effect is what? Fatigue. Identify what causes fatigue and what time of the day it occurs. Monitor patient's hemoglobin level. Educate patient and family members not to worry as fatigue is common. Fatigue is a very common side effect. Advise patient on following: on what not to carry heavy tasks or heavy things. To advise to do anything very slow in a slow manner, not to exhaust him or herself, get help to the household chores, and to take plenty of rest during radiotherapy treatment, and to take multivitamin to avoid fatigue. Right. Then we have another side effect, that is anorexia. Here we have got to educate the patient and family members on how to improve patient's appetite and serve his or her favorite food, and favorite as in any easily digestible favorite food. Then we have to advise the patient on these things: to eat small frequent meals, not large bulks of meals at once. Then take warm food, warm and cold food cold. Okay. Then to take vitamin supplements to boost appetite, and at the same time instruct patient to take high calorie, high protein diet to get rid of anorexia. Then about bone marrow suppression, it's like as we discussed in chemotherapy. Right. Then local effects of radiated site or irradiated sites are as follows. What are those? On head and neck area, we can get these kind of side effects. On head and neck area, mainly like cerebral edema, then mucositis, oral ulcerations, xerostomia, radiation caries like teeth, like dental caries, then any other infections. On chest we can get esophagitis, cough, radiation pneumonitis. On abdomen, the abdominal symptom would be mainly nausea and vomiting. So that is about side effects of radiotherapy, and that is about today's PPT. So we will move on to next PPT, which is the pain management in Sri Lankan settings.